According to county services, 413 people throughout the county took their own lives last year, and many people who are working to reduce that number have a personal connection to suicide, including County Supervisor Ron Roberts, who became emotional while talking about it to SDSU students on Friday. Let's take a look.
Many years ago, as a student here at San Diego State, I was studying in the library, one of those rare occasions, and my wife, Helene, came to find me to share with me the news that my father had committed suicide. I know the personal scars that you carry.
Now here to talk more about a joint suicide prevention effort now underway are Alfredo Aguirre, Director of County Behavioral Health Services, and Ariel Setnar, peer educator at SDSU with the Not on My Watch campaign. Welcome.
Thank you.
Good to be here.
Alfredo, does the county know why suicides are increasing, or at least this past year they have?
Well, it's a complex many factors involved with the increase. Obviously, one suicide is too many in a given year. This obviously is of concern. There's been many links to the economic downturns over the past years or unemployment. However, there's other factors involved. But we are obviously continuing our efforts with It's Up to Us. It just makes us work even harder, but it is of concern.
Demographically, Alfredo, who's most at risk of committing suicide?
35 to 64-year-olds, and in particular men. 75% of suicides are men, and that's been pretty consistent. What's been solidified is the preponderance of suicides among that age group, 35 to 64. Okay,
middle age, but certainly, Ariel, I know that college and universities have their fair share. The Suicide Prevention Resource Center estimated more than 1,000 college and university students die every year by suicide. The Not on My Watch campaign at San Diego State is trying to improve that here. Right. Tell us about it.
So the Not on My Watch campaign is basically, we're going to be handing out a packet of resources, and in this packet we have phone numbers, know the warning signs, basically the signs being, you know, someone's being helpless or feeling lonely, you know, not being themselves, just changing completely, just anything. There's a bunch of warning signs, and basically we will be handing that out during the outreach, and that's tomorrow for a few hours during the day. So it's throughout the week, but it's basically letting people know that this is a conversation that needs to be had.
And why are you involved?
So basically, I did struggle with my own mental health a couple of years ago, and so I ended up getting help by seeing a psychologist, and I think it's so important for people to realize that getting help is what needs to be done, and that's something to be talked about, because I definitely, you know, was like, oh, I'm completely alone, what do? I don't know what to do, I don't want people to judge me, and that's the common theme with someone struggling.
When someone comes to you, a student comes to a peer counselor and says, I want to commit suicide, what happens then? Is there a protocol that you follow to get them the help?
Usually, obviously we have the phone number, which is included on the Not on My Watch campaign, which I have on this bracelet here. It's 888-724-7240. This is the San Diego Access and Crisis line. But we also, if we have it during outreach, you know, we have our therapists on campus. They're available to talk. And then throughout other places, we definitely refer them to the Counseling and Psychological Center.
Okay, and Alfredo, if you see any of those warning signs, or somebody says, hey, look, I'm thinking about killing myself, what should friends, family, students, what should they do if you're hearing that from someone you love or care about?
I think really to ask follow-up questions, to really be as direct as possible. I mean, you're a trusted friend, family member. It's important to work, you know, as part of that relationship is to show your concern. Ask the tough question, you know, have you thought about suicide? And then help that individual, refer the individual to someone who they're comfortable with, whether it's someone in their church, their doctor, their primary care doctor, a guidance counselor on campus. whatever one is comfortable with, and then being with that person throughout the way.
Okay, I want to let folks know that we have a lot of links on our website, kpbs.org, for prevention efforts and suicide resources for both people and their families. So Ariel Setnar and Alfredo Aguirre, thanks so much.
Thank you.
Thank you for having us.